Thank you so much for joining us today for Healthier Business. This is a webinar series hosted by PhD Retirement Consulting, and I'm excited to have with us here today Dr. Ryan Jacobsen. He is the Johnson County EMS Medical Director. He's going to be talking to us from a physical and a healthcare professional expert standpoint. And then we also have with us today Troy Redstone, founder of PhD Retirement Consulting, and he's going to be filling us in on some financial health of businesses today with the new normal of COVID-19. So thank you, gentlemen, both for joining us today.
Absolutely. Thank you.
Thank you.
Well, I don't want to waste any time, so let's hop right into this. We've been reaching out. We've been getting feedback and questions from folks about what's going on. And so, Dr. Jacobsen, I'll first kick this off to you. Obviously, with the shelter in place and everyone being advised to stay at home, go out as minimal as possible, we've seen a lot of businesses pivot to takeout and to go and things of that nature. So one question that has arose is, does this disease transfer on foods or containers when we are buying takeout or getting things to go?
So it's a great question, and it's challenging to give exact answers in this environment. So everything I'm going to talk about has to be couched with the data changes super fast. We're getting more and more data constantly. And I want to encourage people that the public health folks, the emergency rooms, the hospitals are doing their best to get their head around this and try to figure out the best answers for these things. But in specific relation to how the disease is transmitted, and then if there's a risk of fast food or takeout or grocery, it's clear that the primary mode of transmission of COVID is by respiratory droplets. And that is coughing, sneezing, direct contact with body secretions. Typically touching your nose, your mouth, rubbing your eyes after touching something that's contaminated or being in touch with someone's respiratory. That is the primary way in which this virus is transmitted. There is documentation in lab environments that COVID can live on surfaces for some period of time. And this is true of many, many viruses and bacteria. You all see the studies on your iPhone and how many bacteria live on your iPhone or your keyboard or the doorknobs. And the same type of thing occurs with this virus. So inanimate objects that are non-porous, things like plastic, metal, the COVID virus can live for an extended period of time on that. It doesn't replicate when it lands on a environment. It just sits there, and eventually it will die over time. But it can persist there for a number of hours a day, depending on the environment. Now, people are concerned about fast food, about groceries, and I would say I would not worry about fast food and groceries. We have been consuming some fast food and stimulating our local economy by taking takeout periodically over the last few weeks. The thing that I would say to allay everyone's fears, we don't believe right now that getting takeout food is a good, viable transmission method overall. It's typically transmitted by respiratory droplets coming into contact, close contact with someone who has it, touching your face, eyes, mouth, not hand washing and things of that nature. That is overwhelmingly the way that it's spread. So good hand hygiene after you go to the grocery store. Rinse off your fruit and produce with cold water, and if you handle things like bags of takeout or carry out, pizza boxes, things of that nature, all you need to do is do good hand washing before you consume that food and store in regular temperatures like you would for any other food, whether that's the refrigerator or freezer, and prepare it per usual, just using good hand hygiene. So I think this is not the primary method.
Fantastic. Thanks so much for answering that question. That's very informative and good to know, because like I said, it's a question that's come up, and I think it's quite prevalent just in the environment that we're living in today. So I'm gonna hop over to you, Troy. I've got a quick question that has come up. Of course, with all of the market volatility that we've been seeing over the past month or so, folks are curious, what should I be doing with my 401k right now? Is it a good time to jump to cash? Should I sit still, do nothing? Why don't you give us your perspective on that?
Well, I'm going to try to give you just some reasoned safe, and we're not supposed to use the word safe, but I'm going to use the word safe. We're going to try to give you some safe, good advice for just kind of, making some reasonable choices. It is funny when I'm listening to Dr. Ryan, I'm thinking, I hear him say, don't touch your face. I've heard it on TV a number of times. When you hear that, you can't help but want to touch your face, right? So it's just funny how much we actually touch our face. And the markets and everything, it's all, there's so much fear, there's so much anxiety. And I see a lot of people, making bad choices. One of the things you don't want to do, to state the obvious, is jump off a roller coaster when we're actually in flight. So, do you want to get out of the market? Well, you want to sell high and buy low. There's that idea, right? But selling high would have been selling out of the market in mid-February. We were listening to an economist, Allianz's chief economist, and he was actually saying yesterday morning that the time to move to cash and jump out of the market, that train has left. This is not the time to be doing that. And so actually, I'm encouraging people to hang tight. That's what we're doing with our own portfolios. That's what I'm doing with my own money. That's what we're encouraging all of our clients to do, because a bad day or week or even month in the market is very unlikely to impact you, say, 20 years from now. So particularly for those that we work with in retirement plans, don't do anything. That's hard though, right? I mean, it's almost, you don't feel, you feel like inaction is wrong, like you need to be doing something, but really the smartest thing right now to do is nothing. And not overcorrect with your retirement plan, because it could be a very costly mistake.
Absolutely. Great advice. Now, one myth that I think has maybe been floating around, or some news that I've heard, Dr. Jacobsen, is in regards to heat. And so someone suggested that maybe a hot tub could kill the virus. Can you tell us, does heat or dry heat really have an impact on the coronavirus? Are there no cases in Arizona since it's a dry heat place? Could you speak to that a little bit?
Well, there are cases in Arizona. Every state has been affected. There are plenty of cases in Southern California. There are plenty of cases in Tucson, Phoenix, Texas, New Mexico. So this is very much a non-discriminating virus and will propagate kind of in any environment. So ambient temperatures are not really the biggest issue. We're seeing this. For instance, the MERS, the Middle East respiratory, the coronavirus in the 2010s in the Middle East, transmitted in the Middle East environment, very dry, in arid kind of environments as well there. So yes, this virus can be easily killed by any household disinfection, by any soap and water, by any alcohol-based hand gels, and any type of cleaner will kill this virus. It's not a robust virus. It persists as a spore or something that can be activated at later times. It's not going to resist heat. It's not going to resist freezing. It is not like that very otherwise kind of fragile virus, in the sense that most viruses are easily killed. So no, we don't think that generally something like the location or your geography is somehow protective right now. There is some question about, will there be some seasonality to this? Will this be like the seasonal flu going forward for a few years, where it peaks and valleys in the cold climates? Typically, we see this with respiratory viruses frequently because people congregating indoors, people are more exposed to each other, are close to cold, and sometimes cold viruses tend to thrive in a little bit more cooler environments as opposed to hot environments. So remember H1N1, the 2009 pandemic with influenza, that occurred primarily in the summer months here in the United States. That was kind of an April to August, September event. And that persisted in the summer despite being a warm outdoor thing. So we don't know. There are epidemiologists that say potentially this could be seasonal. Potentially in the summer, this will back off a little bit. But we also have the same smart people saying, do not plan on it being seasonal. We just can't predict right now what kind of path it's still in those predictive models, and predictive models are just that. They're not science 100%. They're predictions, just like other predictions. And we have data coming in constantly much you can. So it's hard to give a hard answer on that. But this is not a robust hardy virus that will persist despite heating or freezing or hand washing.
Okay, and I heard you mention something there that raises another question. So I heard you mention, hand washing and alcohol-based, hand sanitizers. Which one should we be doing? Is it one over the other? Is one more effective than the other? Can you give us your perspective on that?
It's a good question. They're held equivalent. In the healthcare community, they're functionally held equivalent. If you have obvious soiling of your hands, so for instance, if you have blood or body fluids, or you actually got contaminated in some way where you can see visible dirt, alcohol hand gel is not the best way to go. Running water, just warm running water with any sort of detergent or soap, absolutely to get the decontamination and absolutely fixes the problem. Most people recommend it for 20 seconds. Make sure you get under your nails, get all the way around, and that seems to be very, very effective. However, if you have clean hands and you're just going from regular routine things like touching a cart in the grocery store, picking up your takeout, alcohol hand gel is absolutely totally fine, and we treat those as functional for its effect.
Very good to know. I would say that definitely kind of sets the record straight, because I've heard differing stories for both sides of that equation. So thanks for clearing that up for us. Troy, one thing with the current environment, of course, we've heard of folks, completely losing income where their companies have had to close the doors, and so folks are just at home and they're not working. You've also had other folks who have had incomes reduced. So during this particular time period, if someone is not working at all or they have reduced hours, should they be contributing to their retirement right
now? Well, it's a complicated question, and there's not a simple answer. It really depends on their situation, right? I mean, depends on their personal budget, and it depends on what they're able to afford to do. It depends on whether there's a company match. Certainly, if you're working for an employer that sponsors let's say a 401k, it could be a 403b or whatever, right? But if there's an employer match and you have the ability to get some free money, which is the employer contribution, simply by putting money in, it'd be kind of crazy not to. But I mean, there could be a great sale this weekend at the store, and if I don't have any money to go to the store, doesn't matter how good the sale is. So you've got to weigh that within your budget. Let's just say, some people will contribute, let's say they contribute a dollar amount as opposed to a percentage. If you're used to contributing like $100 from every paycheck and they're cutting back at work right now and you're working less, then obviously it's going to be a larger percentage of your take-home pay. But if you're contributing a percentage and your pay goes down, then the amount you're contributing goes down too. So most people probably don't need to make an adjustment. I actually, it's funny you should say that, because I actually got a very similar question put to us by one of our clients earlier this week. And we talked about his situation. He was working for an employer that had a 5% company match. He was contributing 10%. I said, well, you could go down to 5 and still get the full company match. And actually, as we talked through it, he realized that 10% was going to be a smaller portion of take home anyway. He decided to just go ahead and stay at 10%. But most people, when they see a down market, are saying, I wish I had money to push in. So I guess overall, if it's within your means not to stop contributing, that would be pretty good advice. But I mean, it has to fit your budget. So it's very case specific, probably.
I can totally understand. Now, again, with all the noise that's been going on and everything, tell us where we are. Are we in a bear market? Are we in a recession? Are we in the Great Depression again? What is your take on where we are in the market and kind of where we might be headed over the next 3, 6, 9 months?
Well, where we're headed the next 3, 6, 9 months, I probably have as much insight on that as Dr. Ryan does on what this virus is going to do, right? Which I have a question for him, if you don't mind, when I want to get back to him. But let me just answer real quickly. Yeah, we're in a bear market. That's really easy. It's determined by being down by more than 20% off of the high. The high was in mid-February. We are deep into a bear market. There's no doubt about it. I guess the message I would want people to hear is that this is very normal. Bear markets are normal. Economic contraction is very normal. It may be obvious, but maybe it's not. We've had almost as many bear markets as we have bull markets. Bull markets are generally longer. Bear markets are shorter. This is an unusual bear market because overall we had low unemployment. We had a strong economy. We had a lot of companies that were very cash heavy. I would say healthy companies, healthy market, healthy economy. And then this happened. And I can't recall just one event like this virus, having such a profound effect. Where we go for the next 3 to 6 months, I mean, it's anybody's guess. I know I am cautiously optimistic. I feel like it's a very strong economy. I feel like once we come out underneath the shadow of this thing, it could be a very, very quick rebound. So I'm not, suggesting run to the hills and hide in cash or anything like that. But yes, it certainly is a bear market, and it certainly is a contraction of the economy. A recession, by definition, is going to be two negative quarters in a row, and so recessions are generally going to be judged in retrospect. So we're going to look back and say, oh, the last 2 quarters weren't so good, and GDP was down, and so it's a recession. So it's hard to say now in the midst of it, but it sure looks like it's probably a recessionary period. It would be hard to imagine that this is not a recessionary period. We did just complete actually 11 crazy, fabulous months of growth, or years of growth. I'm sorry, 11 years of growth. The longest consecutive expansion of our economy in the history of our country is what we just came out of before we came into this situation. So when you would hear people talk about how strong the economy was, that wasn't just crazy talk or political talk. It actually was an incredibly strong economy. And then this happened. And so I'd like to think it's a fairly quick rebound, but it's anybody's guess. I guess, do you mind if I ask a question to Dr. Ryan? Because we're talking about the unknowns.
Yeah, absolutely.
Yeah. So, things keep coming up, and I'm hearing you say, and I've heard a number of people on TV say things like, well, we're not sure, we don't know. Is the virus changing? Like, it seems like we're still constantly kind of trying to figure this out. So on the one hand, I've heard people refer to it as a really very simple virus and then I've heard people say we're still trying to figure it out. Like, I think we were surprised that suddenly it's killing younger people. And is it changing? Is it morphing? I mean, that's probably a really dumb kind of a non-medical, non-scientific kind of a question, but is it a different version of the virus than what was in Italy or what was in China?
So that's a complex question. We know there's at least 8 different circulating strains of this coronavirus. There have been some scientists already.
Wow.
Many of those mutations don't affect the outcome or its infectivity or its clinical course. But the virus is always mutating. And most viruses do mutate. But one of the reasons we don't have good vaccines for common cold viruses, and remember, coronavirus is one of the about 10 to 30% of all of our common colds we get for upper respiratory infections every year are coronaviruses. Now, this one happens to be a different novel coronavirus that is not one we have immunity to and is not commonly seen because it's novel. So it's having a more virulent spreading through the community more quickly because we have no herd immunity, if you will. Coronaviruses we see every year. I see these every year in viral testing in the emergency department in children and adults who have upper respiratory tract infections. Viruses mutate very frequently. They're kind of dumb when it comes to the replication process. Humans, for instance, when we replicate a cell, we have lots of spell checking and lots of double checking and triple checking of our code and our DNA and our RNA is constantly checking and splicing to make sure we're making the right cell. When you see cancer, you see that go awry. So viruses are kind of simple, and they tend to mutate very rapidly. And although the SARS virus is a little bit more sophisticated than some viruses, and it does have some spell checking capability, it's still mutating and will continue to mutate. So yeah, it's a good question, and we know they can track genomically the different genomes of this virus, and they can actually see in epidemiologic studies, there are actually maps, if you go and Google this, you can see the spread of certain strains going across the globe, and that's how they kind of track where something started, because they know that there's a cluster in a community of a certain strain of virus. And so these things are mutating, but it doesn't appear right now that that's got a functional impact, only that it's an academic.
Great, thanks so much. So as we are nearing the end of our time, I've got a couple more questions that I want to ask each of you, and I'll go ahead and stay with you, Dr. Jacobsen. When will this peak in Kansas City? There's been some reports out that could be a few more weeks down the road. As I've heard you mention before, data and things are constantly changing. So maybe as of today, what is the expectation when we'll see this peak locally for us here in the KC metro area?
So there's modeling being done at national level and being done state, and there's hopefully modeling that's even going to be doing county by county. We do have modeling out of a number of different institutions, epidemiologists, academic institutions, and academicians doing the modeling, and there are multiple different sources and inputs and calculations in which people come to the model, how they get to those. For instance, I know the University of Kansas has epidemiologists working on multiple different sources and multiple different predictive models, and they don't match up sometimes. So right now, for instance, the University of Washington's modeling for the country and our state shows us peaking around April 24th to April 27th in Kansas. It shows our graph going up and peaking resources and then trending back down. We look a lot different demographically, and we look a lot different geographically than a place like New York. We don't know what it's going to look like here in Kansas City. We do know that rural America, a very less populated, less densely populated, easier to maintain social distancing, much more austere environments, may not have as much of an impact. But heavily dense urban areas obviously will be hit more severely, typically in outbreak, just by the living conditions. So we think that we're about 2 to 3 weeks out from our peak, and that's based on some epidemiologic modeling. But again, it depends on when you plug in as to what you get out, and the models are kind of all over the map. But I think most people think that as a country, and certainly in the Midwest here, we're thinking 2 to 3 weeks out is when we're going to see our resources, and we'll be able to evaluate further from there.
Great, thank you so much. So last question for you, Troy, and I've got about a minute. What's your best advice financially to survive and thrive over the next 30 to 60 days?
Well, okay, to survive, are you talking about in the market or just in general economy?
That's just in general. My finances are a mess right now. What do I do to survive and thrive over these next 30 to 60 days?
Okay, yeah. So we're talking about a team that's facing a difficult opponent, right? And you got to go back to blocking and tackling. You got to figure out the basic. I think at one point we all knew we should be budgeting, and we kind of got out of that habit. It wouldn't be a bad idea to just really have a budget on paper and understand kind of what your really, your primary. You've got to have food. You've got to have shelter. I mean, you've got to figure out kind of how to survive. I mean, that's the first step. I do hope that on the other side of this, and there will be another side of this, and I don't think it'll be nearly as long as it feels like it is. This too shall pass. I do believe that on the other side of this, there's some important lessons to learn, and just in terms of not living beyond our means and not being so extended in terms of debt and things like that. Because I do wonder, if things like this are not almost the new normal going forward in terms of how globally connected we are. So an event that happens in China could end up being disruptive all of a sudden to our economy several months down the road and whatever. So I just think it's always a good time to be living healthy physically and financially, because you just don't know. You just don't know what's around the next corner. So maybe it's an opportunity for us all to learn.
Absolutely. Well, gentlemen, I appreciate both of your time today. Again, this is the first part in a webinar series from PhD Retirement Consulting. If you have questions, we'd love to gather those, so you can email those to me, mercedes@phdfirm.com. But again, Dr. Ryan Jacobsen, I want to thank you for your time today, as well as Troy Redstone. Thank you both, gentlemen.
Thank you. Appreciate it.
Thank you.